Good morning, everyone. I'm Dr. Rahul Gogineni. My topic is true muscle transplantation surgery in a case series of concomitant large angle alternate exotropia under the guidance of Dr. Raman sir. So, large angle alternate exotropia, it presents with more than 70 to 75 prism diopters of deviation in both eyes alternatively. And it poses a lot of challenges in management due to high rates of recurrence and surgeries of multiple muscles that is required to gain the alignment. So, until 60 prism diopters, surgeries are associated with least complications, but more than that, we need two or more muscle surgeries in two eyes. So in event of recurrences, less number of muscles are spared and larger or maximal recession resections are associated with lid lengthening and palpable fissure height complications. So therefore we obviate the need for the second surgery, we go for muscle transplantation. The muscle transplanted part acts like a biological spacer and the ocular motility is also not compromised. So to report the results in a case series of 19 patients of large angle concomitant alternate exotropia surgically corrected by this surgery. All age group patients presenting with 75 to 90 prism diopters were included in this study. Comprehensive ophthalmic and orthoptic evaluation were undergone and preoperative evaluation, postoperative evaluation on day 1, 7, 1 month, 6 months and for some patients 1 year were also undertaken. Orthotropia is said to be achieved if less than 10 prism diopters of exo or eso deviation is there. In this procedure, the lateral rectus muscle is initially hooked and isolated. Later, the intermuscular septum is cut and followed by medial rectus muscle is cut. Then the resected part of the medial rectus is now transplanted to the lateral rectus and the proximal end is anchored to the sclera at the desired site of fixation. This resected part acts as a biological spacer. So, coming to a few cases, the first case is an 8-year-old child. No significant past history was present. She presented with a CHP of right head tilt and facial symmetry, ocular symmetry were maintained. HCRT was 30-degree exotropia in right eye. Alternate cover test showed both eye moving into take fixation. So with PBCT, we can see in post-occlusion around 70 to 75 prism diopters were present, and muscle transplantation was performed in this patient. That is 10.5 mm lateral rectus recession and 6.5 mm medial rectus resection in the left eye were performed. You can see the pre-operative photo and now post-operative photographs of this child. Now coming to the next child, 14-year-old female, paternal aunt presented with strabismus and 40-degree exotropia was present in HCRT. Full and free movements were present and post-occlusion showed 80 prism diopters deviation. Similarly, muscle transplantation surgery was performed in this child and we can see the results in this patient. So similarly, another 15-year-old boy, family history present and both anterior segment and fundus were within normal limits. He presented with CHP, again left head tilt, and facial symmetry, ocular symmetry were maintained. And post-occlusion PBCT was 75 prism diopters. Similarly, muscle transplantation surgery was undergone, and he was also orthotropic at the end of 6 months as well. This was a peculiar case, 31-year-old. He presented with paradoxical diplopia. Muscle transplantation surgery was undergone. And as you can see in this diplopia charting and Worth 4 dot, you can see uncrossed diplopia. We followed him up for 1 year and recently also he has come to our department and orthotropia is still present. So this is the only case which presented with undercorrection, 33-year-old male. So he presented with 90, he had 90 prism diopters deviation in post-occlusion PBCT. Muscle transplantation was undergone. Around 15 degrees exotropia was present at the end of 6 months. So out of the results of 19 cases, 47% were males and 52% were females. Orthotropia was achieved in 18 cases, that is 94% of the cases, and undercorrection was seen in only one patient. Pediatric population was 47% of the cases. So mean preoperative deviation in all the cases was around 75 prism diopters and mean postoperative deviation was 5 prism diopters out of all the 19 cases. So with the help of this surgery, effective length of muscle could be increased and therefore results could be improved. though there could be abduction limitation due to excessive weakening, no such motility restriction is noticed in these cases. And although large recessions and resections can cause severe restriction, therefore incompetence after getting a good primary position. Thank you. Yeah.
Did you do any comparative study for these things? Means transplantation versus
Actually, madam,
simple recession resections.
I haven't done comparative study, ma'am. This is my thesis topic, checking for novel surgery, true muscle transplantation. So, to observe the results in these patients, we could.
Transplantation, what did you do in transplantation?
Ma'am, we resect the medial rectus part, ma'am. Can I show you the picture?
Yes.
Here, ma'am. So the yellow part, the top right corner, yellow part, the muscle is resected and it is anchored next to the lateral rectus muscle, ma'am. Here, the medial rectus muscle is resected, and that part acts as a biological spacer, ma'am. It is anchored next to the lateral rectus muscle. True muscle transplantation surgery.
How many of these patients were amblyopic eyes?
None of them were amblyopic, ma'am. All of them had nearly 6/6 vision or 6/9. Both of them were alternate exotropia.
And again, comparison with literature, because most of literature is on esotropia. Because
Yes,
in
ma'am.
exo, you get a
Exactly,
very
ma'am.
small
Exactly,
muscle
ma'am.
in exo.
So that's why we took up this study, ma'am, to study large angle alternate exotropia, because we have good results in, we have many results in esotropias, ma'am.
None of the cases you had limitation of abduction post-op.
No, madam. Only the negative result we got was one patient presented with slight undercorrection due to large angle deviation. He had 90 prism diopters initially. Rest of the patients were around 75 prism diopters.
Abduction limitation was
No,
not
ma'am.
there.
No,
Okay,
ma'am.
thank you.
Thank you, ma'am. Thank you, sir.
We have a last presenter.